Hi guys, today's project is going to be about STDs in the senior citizen population. There's a lot of issues with STDs, obviously, a lot of health issues, and it causes different burdens, and it is a global issue. There's problems in the youth population all the way up to the senior citizen population. We're going to focus a lot on senior citizens, just because, again, that's our topic. There's 20 million new infections each year, and it is a significant health burden, like I said, leading to many problems such as cancer, reproductive health, and natal care. Again, why a rise in senior citizen cases? It's more prevalent in older Americans for several reasons. Again, a population, we're growing, we're getting older. As an overall population, we are getting older. Medications are out there to make us live longer and to help with our sexual reproductive issues. Again, with the population getting older, we are getting put into nursing homes, and there's better senior citizen living arrangements out there. So there's a lot of social outings and interactive activities that, again, it leads to a bigger case, more cases of STDs. Again, with STDs, there's over 25 different strains of STDs, and the incident rate is over 20 million new infections. Prevalence rate, 110 million new infections. Total cost, $16 billion a year. That's coming out of taxpayers' dollars because, again, a lot of people that are elderly get Medicare and Medicaids, and we all pay for it. So, again, education is a big key to prevention, and a lot of times we need to educate seniors on safe sex and how to properly use condoms, because when they were growing up, they didn't talk about it much. Top 3 STDs that are prevalent in senior citizen population: chlamydia, gonorrhea, and syphilis. Chlamydia rates, all the data that we'll give you today is from the CDC, and it's a change from 2010 to 2011. And so when you see an increase, it's judging it only from 1 year, which is crazy, and when you see how much of a growth there is. In 2011, there was pretty much 1.4 million cases overall of chlamydia, a rate of 457.6 out of 100,000. This rate increase of 8%, again, that's from 2010 to 2011. With the 65 and older population is 1,064 new cases. This is one of the biggest growths ever in a senior population. Just in the last 3 years, it's pretty significant. Again, the biological makeup of chlamydia, a lot of these STDs that you will see today are gram-stain negative STDs. It's not on this slide, but again, it has a common structure for STDs. Again, STDs affect both men and women, and there it is, gram-stain bacterium. And a lot of times, especially in elderly people, it is asymptomatic, means there's no signs or symptoms a lot of times and so yeah, as senior population, a lot of single people mingling, it can spread pretty easily. So education is key. Chlamydia symptoms, if left untreated: pelvic inflammatory disease, infertility, pelvic pain, and ectopic pregnancy. Again, a lot of issues. The pregnancy issues, we're not going to see that much in a senior citizen population, but it still is, something we have to take into consideration for, like, the pelvic inflammatory disease and infertility and pain. Obviously, as the population's getting older, pain we have to try to mitigate even more. Gonorrhea rates, again, this is from 2010, 2011. In 2011, there's 321,000 new cases. A rate of 104 out of every 100,000 people has gonorrhea. So it's pretty big. Again, this increase, 4% increase since 2010. That also is the biggest increase they've seen in a long time for any STDs, especially in the population. In 65 and older, it's 3.2 out of 100,000. Gonorrhea is also a gram stain negative. bacteria, and it goes by affecting mucal membranes. This is how, again, it's passed down from adult to natal care and stuff is when they have to test for it. But in the elderly, it can affect mouth, eyes, throat, all around. It's serious. It's a serious issue, and it decreases the immune response is increased, so it can actually cause a lot of issues. It is, again, men and women can contract it, and symptoms are usually mild or asymptomatic. Syphilis rates. In 2011, 13,970 reports cased overall. Rates were 4.5 out of 100,000, and in the population 65 and older, 706 new cases out of 100,000 again. Microbiology of syphilis. Again, it's a gram-stain negative. A lot of STDs are, and it can actually cause serious life complications. Funny fact is Adolf Hitler had syphilis, and so did Al Capone. Again, it can be, you can go into stages of syphilis, and it can be asymptomatic at one time, go in hibernation, and then cause neurological issues and even death. Again, all right, here's the different stages of syphilis. Primary syphilis, one or more sores, and genital or around the mouth heals after 6 weeks. Secondary syphilis, 1 to 3 months. Copper rash on palms, hands, feet, warts, white patches inside the mouth, heal without treatment. And tertiary syphilis, if left untreated, there it is. The severe problems can come out with heart, brain, and nerves. Al Capone had a twitch for years and they didn't treat it as such. Syphilis is, and it caused severe long-term issues for him. And it can cause paralysis, blindness, dementia, deafness, and death. Risk factors, STDs. If you're sexually active, misuse condoms, increase partners, and this is huge. And again, elderly in nursing homes and stuff. Maybe not nursing homes, but elderly communities. It's serious issues going on. Cervical ectopy, men who have sex with men, MSM, anal and oral sex, direct contact with sores. These, again, all risk factors. There's a lot of different risk factors for transmission of STDs. We can think of it. We've all passed 6th grade health class, so we can understand a little bit, and we're in college, so we should understand it very well. There are a lot of different programs available to help those suffering from STDs. Sexuality Information Education Council of the U.S., and this provides education to all ages on sex health. This actually just expanded to like the elderly communities. That a lot of elderly communities will have free condoms or at least discuss different health concerns in their community with the patients themselves and with the clientele. SAGE is another one, Services and Advocacy for Gay, Lesbians, Bisexuals, and Transgender Elders. One of the largest organizations for elders. Provides information about sexual health and how to prevent disease from spreading. Also provides information about most prominent STDs in that community. We're talking, again, gonorrhea, syphilis, those STDs, the gram-stain negative ones that we were talking about before. What can be done? More can be done to improve programs geared towards elders. Again, CCAS, like I was saying, it just is an overall educational program, but they are gearing some, if you go to their website, they are gearing some programs now towards the elderly population, since this is one of the biggest growing populations that STDs are transmitted through. And again, they're going through and giving knowledge necessary to be STD free, and comfort in knowing all the information. It is still hard sometimes to talk to elderly people about STDs, so it sometimes is a slow process. SAGE is a huge, like we said before, is a huge advocate for trying to prevent STDs. So they offer a lot more programs, and information about the prominence of STDs in the elderly population. Chlamydia, 2 treatments for chlamydia, and it's forms of different penicillin and antibiotics. Again, all these are gram-stain negative bacteria, so antibiotics are what we use. Again, and gram-stain negative that's just one of the big things about gram-stain negative is what type of penicillin or what type of antibiotic you're going to use. So penicillin usually does work on chlamydia. Abstain from sexual intercourse for 7 days. Doxycycline treatment are finished. And again, you should contact your sexual partners and give them the heads up about issues that are going on. Gonorrhea, there's 5 recommended treatments. I'll let you quickly read over these. But again, the biggest thing for gonorrhea, gonorrhea is changing and mutating enough that some of the treatments and antibiotics out there are actually not even able to fix some forms of gonorrhea. So people can have serious health issues and not be treated for gonorrhea. Again, abstain from sexual intercourse until symptoms subside. Patients should contact all partners, again, within 60 days and make sure they understand that it may be asymptomatic and they should get tested. Syphilis, again, this is more of a test for it, an examination, and you can do different culture swabs and blood tests for part of syphilis, especially if it's in the second and third phases like we were talking about before. And again, for the treatment of syphilis, there it is penicillin, and it's intermuscularly, so it's primary big muscle groups that it's injected by a needle. Again, if the diagnosis is late, and a lot of times it is in the elderly population, because again, for the longest time they didn't even check in the elderly population, like at elderly homes, they would not check STDs, and so sometimes the late stages of syphilis would go unnoticed until it was almost too late. So they are now doing more of pre-screenings and checks for STDs when individuals do get administered into a nursing home or elderly community. And again, the treatment, it just goes for a longer period if you have different stages of the syphilis. Prevention is the key. It's critical in knocking these out. So CDC prevention control strategy is based on 5 key components: creating awareness about STDs, how to change sexual health behavior in order to continue preventing STDs, discovery of asymptomatic and symptomatic people that are unlikely to seek out treatment and screening services, treatment, diagnosis, and counseling of infected persons, treatment, evaluation, and counseling of those that come in sexual contact with infected persons, vaccines prior to exposure of STDs that are in vaccine preventable to those at risk. Again, CDC is one of the biggest, obviously, advocates to try to get these mitigated. The 5 Ps. CDC's primary prevention strategies are, again, partners, prevention of pregnancy, protections from STDs, practices, and past history of STDs. These are what we need to educate and gather from the elderly community when they're going into the, again, elderly community. We need to discuss to them about having partners, and the pregnancy thing obviously is not usually there. But again, how to use condoms, how to and properly and be able to ask for information is one of the, be open to your community when they are asking you for help, and talk to them about practicing safe sex. A lot of them will not come openly out, again, because different generations, different mindset. Secondary prevention is about diagnosis and treatment of early symptoms, and tertiary is definitely need to be treated. The patient has contracted the disease and needs to be monitored for internal damage so it does not occur or get worse. In conclusion, information informing the elderly population about STDs, specifically chlamydia, gonorrhea, and syphilis, and prevention will significantly lower incident rates. Utilizing programs for the elderly can help by increasing knowledge of STDs, explain how to look for signs and symptoms, take advantage of early testing, elderly specific programs can help to diminish the epidemic. Again, by informing the elderly community about prevention and about incident rates, we can actually try to mitigate STD spread.